Hello everyone. The topic for today is sulfonamides and cotrimoxazole. The first topic is sulfonamides. Sulfonamides were the first effective antimicrobial agents used in the treatment of bacterial infection in men. Sulfonamides can be divided into three categories: the systemic acting, local acting, and others, which can be used both locally and systemically, which basically includes sulfasalazine. And the systemic acting can be divided into three parts: short acting, intermediate acting, and long acting. And local acting agents like sulfonilamide. Mechanism of action. The para-aminobenzoic acid basically converts into dihydrofolic acid in presence of folate synthase, and then the dihydrofolic acid converted into tetrahydrate folic acid in the presence of folate reductase. So sulfonamides basically inhibits the folate synthase enzyme so that the para-aminobenzoic acid is not able to convert into dihydrofolic acid. The bacterial resistance to sulfonamides. Most of the bacteria have developed resistance to sulfonamides. It could be due to three factors, that is, decreased affinity of folate synthase for the drug, the efflux of the drug by the bacteria, and the development of alternate metabolic pathway for folate synthesis. The pharmacokinetics. All systemic acting sulfonamides are well absorbed from the gut. They are bound to plasma proteins, particularly albumin. The sulfonamides are distributed in almost all tissues in the body, including the CSF. They cross the placenta barrier and reach the fetal circulation, and they are metabolized in the liver mainly by acetylation. The acetylated products have no antibacterial activity but retain the toxic potential of the parent compound. The adverse effects of sulfonamides. The acetylated products of sulfonamides are poorly soluble in nature in acidic urine and may cause crystalluria, hematuria, or even obstruction to urinary tract. Hypersensitivity reactions are also the major side effects of sulfonamide drugs. In patients with G6PD deficiency, sulfonamides may cause acute hemolytic anemia. They rarely causes hepatitis and suppression of bone marrow. The use of sulfonamides in neonates, especially in premature babies, may cause the displacement of bilirubin from the plasma proteins. So this can be deposited in the basal ganglia and resulting in the kernicterus. The therapeutic uses of sulfonamides. The sulfonamides alone are rarely used now for systemic infections. They are used in combination with other antimicrobial agents. So, sulfadoxine and pyrimethamine are used in combination with artesunate in the treatment of chloroquine-resistant Plasmodium falciparum malaria. Sulfadizine and pyrimethamine combination is the drug of choice for toxoplasmosis. It is also used in nocardiasis. Sulfomethoxazole in combination with trimethoprim is used in the treatment of pneumocystis cerevisiae infection in patients with AIDS. Sodium salt of sulfonilamide is used exclusively for the treatment of ophthalmic infections. It is administered as eye drops or eye ointment. It is preferred because of it has high aqueous solubility, neutral pH, and non-irritant nature of the drug. It has a good penetrability or topical administration, and because of the low cost factors. It is also used for the rheumatic fever, as it basically given as a prophylactic drug in rheumatic fever. Now, the second drug, cotrimoxazole. Cotrimoxazole is a WHO approved fixed dose combination of sulfomethoxazole and trimethoprim in the ratio of 5:1. So the mechanism of action. The para-aminobenzoic acid in presence of folate synthase converts into dihydrofolic acid, which then converts into tetrahydrofolic acid in presence of dihydrofolate reductase. So basically the sulfomethoxazole inhibits the folate synthase, and the trimethoprim inhibits the sulfomethoxazole and trimethoprim in the ratio of 5:1 products sequential blockade, that is, two drugs interfere with two successive steps in the same metabolic pathway. Hence, their combination produces supra-additive effect. The adverse effects of cotrimoxazole. The cotrimoxazole is well tolerated in most patients. Most of the adverse effects are same as that of sulfonamides. The common adverse effects are skin rashes and GI disturbances. The exfoliative dermatitis, erythema multiforme, and Stevens-Johnson syndrome are rare. It also causes rarely megaloblastic anemia due to folate deficiency, which can rarely, but especially in alcoholics, malnourished, and persons with bone marrow suppression, with leukopenia, neutropenia, and thrombocytopenia. The therapeutic uses of cotrimoxazole, it is given in patients in UTI infections, bacterial respiratory tract infections, bacterial diarrhea, typhoid fever, pneumocystic xerovicae, and nocardiosis and chancroid infections.